Hello, everyone, and thank you for joining us today. The Ketchum team will be moderating today's bi-monthly forum, which aims to provide national stakeholder organizations, specialty societies, health IT organizations, and EHR vendors with information relevant to CMS's quality measurement and value-based incentives group. Our program today will include updates on the Medicare Promoting Interoperability Program, the Measure Compare feature on the ECQI Resource Center, QRDA-1, the January 2022 Fire Connectathon, an Outpatient Quality Reporting ECQM, the Quality Payment Program, and alternative payment models. We will have a question and answer portion once all presentations have concluded. Please note, to ask a question, you can either submit your question using the chat feature or raise your hand and CMS will unmute your line. For those dialed in via phone, you must have your audio PIN entered. If you're listening through your computer speakers and want to ask a question, you must have a working microphone. And now I will turn it over to Drew Morgan. Drew, you may begin.
Thank you, Joy. Hi, my name is Drew Morgan. I'm with the DeVicker at CMS. I oversee the PI program along with the hardships and reconsiderations waivers regarding to that program. And I just want to give you a little bit of how the program did for the 2020 reporting year, which folks went in January of this year and reported their measures. Next slide, please. The 2020 Medicare Promoting Interoperability Program, we continue to implement performance-based scoring methodology in this program where critical access hospitals and eligible hospitals attest to CMS under the program. Eligible hospitals and cause are required to report on measures from 4 performance objectives, which then contribute to an eligible hospital or cause total performance program score. In order to be successful, you must score a minimum of 50 points, which was required to satisfy the scoring requirement. Next slide, please. So here are some key highlights to the 2020 Medicare program. We had roughly 3,300 participants. They had tested on the eligible hospital side to promoting interoperability. 86% of the participants, they scored either minimum of 50 points or greater. The average score was 72.32 out of a possible 100 points. And there's a kind of a breakdown here. So where we can see the majority of people who submitted their data scored in that 70 to 79 point range. Also, along with this, we did have a hardship period where hospitals, if they didn't meet the requirements, could come in and apply for a hardship waiver, so they would not be payment adjustment in 2022. All in all, we just had 135 hospitals that were approved for a hardship waiver. We just recently closed the reconsideration process where they could come in a second time to request a hardship waiver if they missed the initial period. We approved 56 hospitals under that period for a total of 191 waivers. So for 2022, we have roughly 110 hospitals that will have their payments reduced through PI. That is down from last year where we had 118 hospitals that were payment adjusted. Next slide, please. So some key highlights for critical access hospitals or CAHs. We had 1,326 participants that had tested. 77% of participants scored the minimum or higher on points. Their average score was 73.35. As we look at it, again, that 70 to 79 range was the highest where the majority of those folks kind of scored. We had maybe 29 hospitals that attempted their scoring but did not reach the 50-point threshold. As with the hardship numbers, we had 86 come in the initial hardship period. We approved 86 applications. During reconsiderations, we approved a little bit more at 94 for a total of 180 waivers. The CA hospitals, there will be 112 hospitals that will have their cost reimbursement adjusted downward to 100% from 101%. In last year, we had 138 hospitals that landed on that downward payment adjustment. So there's a significant improvement on those numbers. Next slide, please. And I will send it back to Joy to.
Vidya Salapan and Joe Mester will present next.
Hello, my name is Vidya Salapan. I'm the CMS lead for the ECQI Resource Center, and Joe Mester of Battelle, and I will share some information about a new measure compare feature on the ECQI Resource Center. Next slide, please. So the Electronic Clinical Quality Improvement, or ECQI Resource Center website, provides a centralized one-stop shop for stakeholders engaged in electronic clinical quality improvement. CMS and the ECQI Resource Center team provide a user-friendly website with the most up-to-date information pertaining to the technical requirements of electronic clinical quality measures, or ECQMs, in the CMS quality reporting programs. Next slide, please. Now I'm going to have Joe take over to talk about the new feature. Joe?
Thank you very much. Hello, everyone. Great to be here. What we're looking at here in our presentation is the homepage for the ECQI healthit.gov website. And here we're going to see a tool that was actually released about a month ago, maybe a little more than that, where we have the performance period and an area to type in, find an ECQM, and get a predictive list. This was a feature we released to get you to your measures more quickly. And now what we've done is we've improved upon that and added a way for you to compare measures from year to year. Next slide, please. So a few different ways to navigate through this. We've got the ability to go from that area where I first talked about. Also, you can click in the menu here and then navigate through the measures. So a few different ways to get into this compare tool. Next slide, please. And once we, next slide, another way to get into the compare tool, just drilling down here through the information. And we'll see here when we filter to our EC or ECQMs, we have our measure name and the ability to work here with the year. And if we then go to the next slide, after selecting a measure, we will be provided the ability to, at the top there, search again from this page, or down here at the bottom, begin to work with our comparison. So when you click that compare button, we're going to go to the next slide, and what we will see is the 2022 year compared to the 2021 performance year, with some options here for exporting that information out for you. So this page is going to be really great for you. You can highlight things based on the difference or the constants between years. That's that middle filter there. And on the right-hand side, the download filter, we've got that big red arrow pointed to. This gives you a few different download options. So we have a CSV format, which will open up for you probably by default in Excel on your computer. If not, you can use that format for CSV for various types of data importing. So if you're using another system and they ask you for a comma-separated values, that's what CSV stands for. Then the other options we have here are PDF, and we actually get two types of PDF for download. We have one that is a text-based PDF that allows you to highlight and search through the PDF and work with it, and then an image-based PDF, which actually shows the orange or red highlighting that we see here on the screen, and that one shows that highlighting while the text-based one does not. So just a little option there for you to work with either one, have a visual one up next to the text one while you're working on it. And then finally, we have the option here for XML export. So if you need that for any reason, we are able to provide that for you and let you use it. So we're really excited to roll this feature out and have you all start working with it and then give us some feedback on what you want to see happen next with it. Next slide, please. So yeah, if you have any questions about it, here's our contact information. I encourage you to go to the website, check it out after this call and work with the tool a little bit. And then, let us know how it works for you so that we can improve it and keep making it better and more useful. And with that, we'll go to the next slide and I will hand it off to the next presenter.
Thank you, Joe. This is Ian Harris with ESAC. Next slide, please. So CMS has posted updates to the 2022 CMS QRDA Calculator 1 implementation guide and sample files for hospital quality reporting. The 2022 CMS QRDA 1 IG outlines requirements for the eligible hospitals and critical access hospitals to report ECQMs for the calendar year 2022 reporting period. Next slide. There are 3 changes made to the IG in this update. So the first change is to correct a formatting issue in Table 3, the record target constraints overview. So the rows in the table are displaying in the correct order. The second change is that a guidance is added to the Section 5.1 validation rules for encounter performed to document the schematron rule enforcing the allowance of only one encounter diagnosis QDM template with a rank attribute equal to 1. This validation was already part of the previously published schematron, so there's no impact to the schematron itself. The third change is that 2 new conformance statements, CMS 0087 and CMS 0088, are added to Table 14 other validation rules for HQR programs. These 2 are generic validations to ensure low date is after high date if the datetime is a time period, and also datetime submitted is in valid datetime format. So like all the other validation rules in this table, they are not part of the schematrons. Next slide, please. For the 2022 QRDA 1 schematrons and sample files, there are no changes made to the schematrons, so the updates only involve the hybrid measure sample file. The hybrid measure sample file was updated to include example for the hybrid hospital-wide risk standardized mortality measure and the additional core clinical data element, platelet count that is specified for this measure. The sample file was also renamed because it now contains examples for both hybrid measures. So these are all the changes to the 2022 CMS QRDA 1 IG and sample file. Next slide, please. For additional QRDA related resources, as well as current and past IGs, you can visit ECQI Resource Center QRDA page. And for questions related to the QRDA IG and or schematrons, you can log an issue in ONC JIRA under the QRDA project. For solutions that are under development for both QRDA 1 and 3, known technical issues, you can visit QRDA known issues dashboard that is also in ONC JIRA. So thank you, everyone. I'll now turn to Jen for the next presentation.
Thanks, Yan. Next slide. Yeah, we just wanted to give a quick announcement that the CMS ECQM standards team will continue to support fire testing at the January Connectathon. That is a virtual event that will occur January 10th through the 12th, this 2022. We, again, will continue to test draft fire measure specifications, the content, the logic, the capabilities. We'll also review measure repository capabilities, data requirements, shared libraries, etc. And additionally, work on some measure terminology service, and that will include version-specific expansion of value sets. You can visit the clinical reasoning track page there at the link provided, and if you have questions or would like more information, feel free to email us at fire@icf.com. And that is my update. I will pass it to Tamara. Thank you.
Thanks, Jen. Hi, everyone. My name is Tamara Mohammed, and I lead work at the Yale Center for Outcomes Research and Evaluation to support the implementation of measures in the Outpatient Quality Reporting, or OQR program. Next slide, please. So today I'm here to provide you with some information on the ST segment elevation myocardial infarction, or Stemi measure, that CMS recently added to its OQR, or Outpatient Quality Reporting program. We'll talk a bit about the measure itself in a few minutes, but for now, I wanted to note that in the calendar year 2022 OPPS, or Outpatient Prospective Payment System rule, CMS added the Stemi ECQM, that's the Stemi Electronic Clinical Quality Measure, to the OQR program. And this is in particular noteworthy as this measure represents the first ECQM type measure to be added to the OQR program. For those of you not familiar with ECQMs are measures that use data from electronic health records and or health information technology systems to measure healthcare quality. So the use of the ECQM here represents a change from the use of claims or chart abstracted data, for example, to measure healthcare quality in the OQR program. And so in the 2022 OPPS rule, CMS finalized the use of the Stemi measure for 1 year of voluntary reporting, which will use calendar year 2023 data that's associated with calendar year 2025 payment determination. And then mandatory reporting of the measure begins immediately after that. So the first year of mandatory reporting will use calendar year 2024 data for calendar year 2026 payment determination. The Stemi measure has been given the OP40 shorthand and replaces the use of the OP2 and the OP3 measures in the OQR program, which are both chart abstracted measures. The OP2 measure is the fibrinolytic therapy received within 30 minutes of ED arrival measure, and the OP3 measure is the median time to transfer to another facility for acute coronary intervention measure. I'm not going to go into detail about these two measures, but I did want to note that the populations captured by the OP2 and the OP3 measures are captured under the OP4 measure, or the Stemi ECQM measure. And so CMS, in the calendar year 2022 OPPS rule, finalized the removal of the OP2 and the OP3 measures from the OQR program, beginning with calendar year 2023 reporting period or calendar year 2025 payment determination. And this coincides with when we're actually adding the Stemi measure to the OQR program. Next slide, please. Okay, so we'll talk a bit now about the Stemi measure itself and how it functions. The Stemi measure is a process measure, and it seeks to assess the timely provision of care to patients who present to the ED for Stemi, which is a form of heart attack. As I mentioned before, it includes within it the populations that are currently captured by the OP2 and the OP3 measures, but specifically the Stemi measure assesses the percentage of patients aged 18 and over who visited the ED with a diagnosis of Stemi and who broadly received either fibrinolytic therapy within 30 minutes or a transfer to a PCI-capable facility within 45 minutes. I will get into a bit more specific detail on this in the next slide, but I did want to note that the slide here says that we submitted the measure to the National Quality Forum, or NQF, for endorsement, but we actually received NQF endorsement earlier this month. So as an update, I am happy to report that the measure is now NQF endorsed. Next slide, please. Okay, so to get a bit more specific about what the measure captures, the measure denominator includes all ED visits for patients 18 years and older with a diagnosis of Stemi. And of those ED visits, the numerator includes ED visits for patients whose time from ED arrival to fibrinolytic therapy was 30 minutes or less, or who arrived at a PCI-capable facility without being transferred and received PCI within 90 minutes of arrival, or who arrived at a non-PCI-capable facility and were transferred to a PCI-capable facility within 45 minutes of arrival. Next slide, please. And so with regard to what hospitals are being asked to report for ED visits that meet these criteria, As per the calendar year 2022 rule, hospitals are being asked to report voluntary data for the STEMI measure based on ED visits that occurred in calendar year 2023. So they're asked to voluntarily report at least one quarter and any quarter of calendar year 2023 data that would typically be used for calendar year 2025 payment determination. And then beginning with the calendar year 2024 data or calendar year 2026 payment determination, reporting of the STEMI measure becomes mandatory. So hospitals are asked to report at least one quarter, again, any quarter of calendar year 2024 data for calendar year 2026 payment determination, and then any 2 quarters of calendar year 2025 data for calendar year 2027 payment determination, any 3 quarters of calendar year 2026 data for calendar year 2028 payment determination, and then beginning with calendar year 2029 payment determination, they'll be asked to report all 4 quarters of the calendar year data for the STEMI measure. So all 4 quarters of calendar year 2027 data for calendar year 2029 payment determination. Moving, next slide, please. So this is just a really quick summary of the measure. If you would like more information on what CMS finalized in the rule for the STEMI measure, please do refer to the calendar year 2022 OPPS final rule that we've included a link to here. Additionally, you'll find the specifications for the measure on the ECQI or Electronic Clinical Quality Improvement Resource Center. This is the website that CMS uses to house ECQM information. And I'll walk you through in the next few slides where to find the STEMI information on this website. And then lastly, you can submit questions about the STEMI measure to the ONC JIRA tracking system. We've included a link here on the screen, but I'll also walk you through how to find this page in the next few slides as well. Next slide, please. Okay, so if you're trying to find the STEMI measure specifications on the ECQI Resource Center, first you'll need to navigate to that website. The address for the website is https://ecqi.healthit.gov, and you can see a screenshot here of what that landing page looks like when you get to the website. Next slide, please. At the top of the landing page for the website, you'll see a horizontal menu. If you hover over ECQM's electronic clinical quality measures in that menu, which is the first big red arrow that you see on the screen, then a drop-down will appear. And in that drop-down, we've created an option called OQR Outpatient ECQMs, and that is the second big red arrow you see on the screen. And if you select this, it'll take you to the page on the next slide. Next slide, please. And this is, in essence, the landing page for information on the STEMI measure. This slide contains a screenshot of the page, what the page looks like, and here you'll find links to the STEMI measure specifications and the value sets. The measure value sets are just lists of terms or values in their codes that we use to describe clinical administrative concepts in quality measures. At the bottom of this page, the link in the first table will take you to another page that contains the measure specifications, and the link in the second table will open the measures value sets. Next slide, please. Okay, so that was how to find the measure specifications and value sets. Now, if you'd like to submit a question about the measure, you go to the ONC project tracking link here that you can see on the left-hand side of the screen. Once you log in, it's free to create an account. You will see the page on the screen here. To ask a question or create an issue, you will need to click on the blue create box at the top of the screen, circled in red. Next slide, please. And once you do that, it will take you to here, and under Project ECQM Tracker CQM, you will select OQR ECQMs as the issue type. And from there, you can write and submit your question, and we'll aim to get back to you as soon as we can. And now I'll hand it over to Julie Johnson for the next segment of the presentation.
Hello, yes, I am Julie Johnson, and I work for the Center for Clinical Quality Measures and Standards, and I am here to give you some quality payment program updates for the Performance Period 2022. Next slide, please. So CMS has published the 2022 Physician Fee Schedule Final Rule, and that was posted November 2nd, 2021. Some key QPP policies in the rule include revising the definition of merit-based incentive payment system, or MIPS, eligible clinician types to include social workers and certified nurse midwives. We are setting the MIPS performance threshold at 75 points and exceptional performance threshold at 89 points. We are weighting the cost and quality performance categories equally. This is statutorily required, and they're both going to be at 30%. We are revising the quality scoring policies, including the introduction of a floor for new measures, 7 points for the first year, 5 points for the second year, and removal of outcome high priority measure bonus points and end-to-end electronic reporting bonus points. We are extending the CMS web interface and traditional MIPS for the 2022 performance year only. The CMS web interface will be extended for the Shared Savings Program ACOs through performance year 2024. So there is a little bit of a difference there. If you are a MIPS group, you will only be able to report through the CMS web interface for the 2022 performance year. Next slide, please. The following updates were, oh wait, hold on one moment. The following updates were also included in the final rule and affect future years of QPP. Finalizing 7 MIPS value pathways that will be available beginning with the 2023 performance year, providing a description of the registration process and timeline for MVP and subgroup registration beginning with the 2023 performance year. Starting with performance year 2023, the 3-point floor for quality measures that can be scored against a benchmark, don't have a benchmark, or don't meet case minimum will be removed. But that 3-point floor still exists for the performance year 2022. For more information, please review the recording slides from the 2022 Final Rule webinar and the following resources in the QPP Final Rule Resources zip file, and that includes the overview fact sheet, the policies comparison table, the MVP policies table, frequently asked questions, and MVP development template. Next slide, please. The QPP exception applications. There are 2 exception applications available to clinicians in performance year 2021. That is the extreme and uncontrollable circumstances exception application and the MIPS promoting interoperability performance category hardship exception application. If you are a MIPS eligible clinician who is eligible to participate in MIPS as an individual, the MIPS automatic EUC policy will be applied to you for performance year 2021. To apply for these exception applications, you're going to want to sign into the QPP website with your HARP credentials and click exception application on the left-hand navigation. The deadline for the EUC exception application and MIPS promoting interoperability performance category hardship exception application is December 31st at 8 p.m. Eastern Time. For more information, please review the guides that are posted on the resource library. There's one for the EUC exception application, another one for the promoting interoperability hardship application. Next slide, please. The 2021 automatic EUC policy. This is to provide relief where possible to clinicians responding to the 2019 coronavirus public health emergency. We are applying the MIPS automatic EUC policy to all individually eligible clinicians for the 2021 performance year. The automatic EUC policy only applies to clinicians who are eligible to participate in MIPS as individuals. The automatic EUC policy doesn't apply to groups, virtual groups, or APM entities. If you are a clinician who is eligible to participate in MIPS as an individual, you don't need to take any action to have the automatic EUC policy applied to you. You will be automatically identified and will have all 4 MIPS performance categories reweighted to 0%, and you will receive a neutral payment adjustment for the 2023 MIPS payment year unless you submit data in 2 or more performance categories, or you have a higher final score from group or APM entity participation. For more information, please review the 2021 MIPS Automatic Extreme and Uncontrollable Circumstances Policy Fact Sheet and the QPP COVID-19 Response Fact Sheet. Next slide, please. The 2020 preview period for doctors and clinicians, it closes today at 8 p.m. Eastern Time. To preview your 2020 QPP performance information before it is publicly reported on clinician and group profile pages on Medicare Care Compare and in the provider data catalog, sign into QPP using your HARP credentials. For more information, please refer to the following resources. We've got recording. We have a preview period performance information with reporting slides and a transcript posted. We have a preview period user guide, and then we have on the CMS.gov website, Doctors and Clinicians Initiative page. Next slide, please. Virtual group election period. This will close at 11:59 p.m. Eastern Time on December 31st, 2021. To receive approval to participate as a virtual group for the 2022 performance year, you must submit an election via email to the MIPS virtual groups at cms.hhs.gov email address. If your virtual group was approved for the 2021 MIPS performance year and intends to participate in MIPS as a virtual group for the 2022 MIPS performance year, your virtual group is still required to submit an election to CMS for the 2022 MIPS performance year. To learn more about virtual groups, please review the resources in the Virtual Groups Toolkit. Next slide, please. 2021 and 2022 MIPS eligibility. You can now visit the QPP Participation Status tool and review your final 2021 MIPS eligibility status. We've updated your eligibility status based on our review of the Medicare Part B claims and provider enrollment chain and ownership system, or PACOS, data from the second segment of the MIPS eligibility determination period, which is from October 1st, 2022 to September 30th, 2021. This status is final unless you participate in an advanced APM and your qualifying APM participant QP status changes as a result of the third APM snapshot for performance year 2021. Results from the third APM snapshot will be available in the coming weeks and will be announced through the QPP listserv. You can also check your initial 2022 MIPS eligibility status using the QPP Participation Status tool. Just enter your National Provider Identifier, or NPI, to find out whether you need to participate in MIPS during the 2022 performance year. For more information, please review the 2021 MIPS Eligibility and Participation Quick Start Guide and the 2021 MIPS Eligibility and Participation User Guide. Next slide, please. Payment adjustments for the performance year 2020. Payment adjustment information for performance year 2021 and payment year 2022 was released in August. The payment adjustments will go into effect on January 1st, 2022. You can currently access your 2020 MIPS performance feedback, your 2020 final score, and your 2022 payment adjustment information by going to qpp.cms.gov/login. This is the QPP website. Logging in using your HARP system credentials. These are the same credentials that allowed you to submit your 2020 MIPS data. For more information, please review the 2022 MIPS payment year payment adjustment user guide and the 2020 MIPS performance feedback and 2022 payment adjustment FAQs. Next slide, please. The performance year 2021 data submission window. This will open on January 3rd, 2022. You must sign into QPP to view data submitted on your behalf or to submit data on behalf of yourself as a solo practitioner, individual clinicians or the group as a practice representative, your virtual group as a virtual group representative, your APM entity as an APM entity representative submitting quality data. Next slide, please. For the quality measure specifications and benchmarks, CMS released the following measure specifications, and they are available on the resource library. We have released the Medicare Part B claims measure specifications and supporting documents and the clinical quality measure specifications and supporting documents for the performance year 2022. We also have them available for 2021. We have also released the 2021 quality benchmarks and the performance year 2020 benchmarks, which are used to assess performance in the quality performance category. Next slide, please. We have some upcoming webinars. The web interface transition webinars for groups, virtual groups, and APM entities that have been reporting data for the quality performance category through the CMS web interface and who are required to transition to a different submission mechanism during the future years of MIPS. We highly encourage you to attend this webinar, and these will be held January 19th and February 16th in 2022. There are going to be web interface support calls for groups, virtual groups, and APM entities that are reporting data for the quality performance category through the CMS web interface. These are scheduled for January 26th, February 9th, February 23rd, March 9th, and March 23rd next year. Next slide, please. We have some new resources on the resource library. We've got the 2022 final rule resources. This includes a final rule overview fact sheet, a policy comparison table, an MVP policy comparison table, an MVP development standardized template, and that's if you want to submit an MVP candidate, and a set of frequently asked questions. We have the 2019 QPP Experience Report. This provides insights into participation and performance in the MIPS and advanced APM tracks during the 2019 performance year. We've got a web interface Excel template, an Excel template with sample data, and a data dictionary. This helps users understand and input submission data for the CMS web interface for the 2021 data submission period. Next slide, please. Some upcoming resources. These will be posted in the resource library. We've got some quick start guides coming, some specialty guides, data submission videos, the group participation guide, data submission FAQs, data submission user guide, CMS web interface submission guide, an opt-in toolkit, web interface videos, and QPP access guides. Next slide, please. And I believe I'm handing it over to Corey to talk about alternative payment model updates.
Good afternoon and good morning to those on the West Coast. Next slide, please. 2022 final, the PFS final rule. In 2022, we made some final rule finalizations that included subgroups will be a part of or a participation option for reporting the APP or the APM performance pathway, beginning with the 2023 performance year. So again, we finalized that subgroups will be a participation option for reporting the APP, beginning with the 2023 performance year. We also finalized the following changes related to the Medicare Shared Savings Program. First, we're extending the CMS web interface as an option for 3 years. So through the 2024 performance year, to provide a longer transition for ECQMs, MIPS CQMs, measure reporting for the Shared Savings Program, Accountable Care Organizations, or ACOs, that report through the APP. In addition, we made the following change for the Medicare Shared Savings Program, that for performance year 2022 and performance year 2023, an ACO will meet the quality performance standard if it, 1, achieves a quality performance score that is equivalent to or higher than the 30th percentile across all MIPS quality performance category scores. That excludes entities and providers eligible for facility-based scoring. Or if the ACO reports the 3 ECQMs, MIPS CQMs, meeting data completeness and case minimum requirements for all 3 measures, and achieves a quality performance score equivalent to or higher than the 10th percentile of the performance benchmark on at least one of the 4 outcome measures in the APD measure set, and a quality performance score equivalent to or higher than the 30th percentile of the performance benchmark on at least one of the 5 remaining measures in the APP measure set. You can find more details about that also in our final rule. Next slide, please. In addition to the final rule policies we just mentioned for the Shared Savings Program, CMS also finalized a policy to extend the current QP, the Qualifying APM Participant Incentive Payment Processing, the hierarchy to include billing TINs that are active only during the payment year. Adding this step to the process hierarchy, or the processing hierarchy, will make it easier for CMS to complete payments to more QPs in the first round of QP incentive payments. This will enable also CMS to look for payee TINs that are active in the base year or the payment year for each step of the hierarchy. For more information, please look at our QPP 2022 Final Rule Resources zip file. Next slide, please. QP and MIPS APM participation information, similar to the slide that Julie just shared with you. In the coming weeks, CMS will update its QP or the QPP participation status tool. Now, the tool has been updated for MIPS, but we are updating on the APM side the third snapshot data for APM entities. The third snapshot data includes data from Medicare Part B claims with dates of service between January 1st, 2021 through August 31st, 2022. The tool includes 2021 QP and MIPS APM participation status. If you join a MIPS APM in the last 4 months of the year, and that is from the end of this third snapshot until the end of the performance year, you will be considered a participant in the MIPS APM, and you will be eligible to voluntarily report through the APP. To learn more about these options, please not only visit the QPP participation status tool, but also check out the Advanced APMs webpage and also the QPP website. Next slide, please. Next slide, please. All right, can you guys hear me okay?
Yes, Corey, we can hear you. Joy, are you able to transition to the next slide?
Yeah, I lost connection on the slide, so I know the last slide. The last slide that we have here is the new resources. The performance year 2021 APP quality requirements for all participants is available now. That contains the APP quality data submission options, the APP quality measure set for all participants, and the APP quality measure specification. In addition to that, the second measure set that you'll find on the APP quality performance page or the quality requirements page is the performance year 2021 APP quality requirements for Shared Savings Program ACOs only. Specifically, those are the APP quality data submission options, the APP quality measure set for Shared Savings Program ACOs only, and the APP quality measure specifications. These are available on the resource library, and we're working to link them so that you can find them on either page. That is the quality requirements for APP and or in the resource library. In addition, we have the 2022 learning resources for all payer, and that includes resources to help QPs participating under the all payer combination option during performance year 2022. And then finally, we've updated the 2021 and 2022 comprehensive list of APMs, and that displays the comprehensive list of APMs for both years, including other details about the different models and their participation options. Last slide, we'll hand over to Kesha. Thank you.
Thank you to all of today's presenters. We will now move on to the question and answer portion of the webinar.
Great, and as a reminder, to ask a question, you can either submit your question using the chat feature or raise your hand and CMS will unmute your line. For those dialed in via phone, you must have your audio PIN entered, and if you're listening through your computer speakers and want to ask a question, you must have a working microphone. We will stand by for our first question. Okay, and our first question is for Joe on the ECQI compare feature. And this individual is asking, how are the differences determined? If there are any changes in any section, or does it show specific points that the measure steward has determined to be changes in measure intent or specs or curation of measure intent?
Yeah, so great question. Basically, it is a one-to-one compare. So if there is a space or a period even that is changed, we're going to highlight that in that measure information in the table and let you know. So we do look at the underlying HTML to an extent, and then literally it's a word and character compare. We're hoping in the future we'll be able to get a little more granular with that, and you'll actually have some underlining or highlighting of the specifics that have changed in the paragraph, but this initial phase we were able to get just general highlighting working for everybody.
Thank you. And our next question, I believe, is for Tamara, and this individual is asking, will OP2 and OP3 measures remain as MB QIP measures?
Hi, I'm not really as familiar with the MB QIP measures. I do know that they're being retired from the OQR program, but if you have a specific question about MB QIP, I can look into it after the call, or you can email the question and we can look into it then.
Thank you. And then I do believe we have another question for you. Will the OP ECQM be written in CQL?
That's a great question. I think it's currently in QDM, so there might be a plan to transform it into CQL. I will confirm after this call and get back to you on that as well.
Thank you. And then another question for you. So STEMI transfer greater than 45 minutes due to hospital transfer closure. Will that count against us?
Sorry, as in the hospital was closed and so the patient was not transferred within 45 minutes? Is that?
Yes, I believe that's the question.
I don't think currently there is an exclusion in the measure to account for the fact that a hospital was closed, and therefore that would count against the hospital. But I think I can take that back to the team who developed the specification so that they can consider those scenarios for the measure.
Thank you. And our next question, which I believe is for Jennifer, and this individual is asking, when is FHIR going live for all EHR vendors?
So CMS is working very diligently to put together a timeline for that transition. Unfortunately, we don't have a date to communicate at this time.
Thank you, Jennifer. And I believe we have another question, and this is for Julie. When is traditional MIPS slated to sunset?
We do not have a sunset for traditional MIPS at this time.
Thank you, Julie. Okay, and we will go to a phone line question. So Carrie Durnett, your line is now unmuted if you'd like to ask your question. Carrie, your line is unmuted. Okay, we will come back to Carrie if we can. Let's see, we will stand by for our next question. Okay, we will go back to a phone line question, and Peter Bash, your line is now unmuted. And Peter, you may be self-muted.
Okay, thanks. Can you hear me now?
Yes, we can.
Great, thank you. And this is a follow-up question for Joe on the compare tool. I appreciate the answer to my first question that I sent online, that it's a simple compare of characters and spaces and so forth. Is that compare featured just for the description section of the measure, or will it also show if there are differences in the HTML file where there's often more detail?
So that HTML file is parsed into the website. So there's some cleanup work that is done there initially. So it's not the pure HTML file, but it does look into the script, it looks across everything, all the fields in that file. So if there is a difference in the denominator exclusion language or in numeric values, it'll pick those up, but it's not going to pick up pure HTML changes of like a paragraph changing from paragraph to paragraph with bold or something of that nature. That was something that I'm hoping to iterate on in the future and be able to get that granular with it, so we can say, oh, in version year 2020 you used HTML4 markup, and in 2021 you converted it to HTML5 and started using these new element tags.
Great, thank you very much.
You're welcome.
And we do have a few minutes left before the call ends. So as a reminder, to submit a question, please submit that via the questions box or raise your hand and we will unmute your line. Does not look as if we are receiving any additional questions at this time. So I believe that concludes the Q&A portion. Thank you all for joining us today. We will share the slides and recording from today's forum in the coming weeks. In the meantime, if you have any specific questions, please email cmsqualityteam@ketchum.com. The next CMS Quality Program's bi-monthly forum is tentatively scheduled for February 2022, but CMS will share more information on the next forum when it becomes available. Have a great afternoon.